back. From your chiropractic team, you are just giving us so much encouragement that maybe there's some different options that could be an alternative.
Well, yeah, absolutely. Until recently, most people would think that all you can do is either just physical therapy or just chiropractic or just do surgery for your back pain. And now there are so many new technologies that are coming out that are non-invasive and don't lead to the disability that a lot of times is accompanied with surgery. And it's really, really simple. A lot of times people complicate their back condition by thinking that their condition is unique. And realistically, it's not that difficult to get rid of back pain if you do the necessary and proper steps to get rid of it.
So today we're talking about a three-step process, and it sounds fairly easy. Can you talk us through that?
Yeah, most back pain, when somebody experiences it, at first they're going to experience muscle weakness. Either their core muscles have weakened, and over time what happens is because their back weakens, then they get a disc injury. And once the disc is injured, it starts to put pressure on the nerve, and that's how they get back pain. So what you want to do is you want to target those areas that have been affected, and we do that through 3 easy steps. First, we target the disc, and we use what's called an advanced spinal decompression procedure, which allows us to fix a herniated or bulging disc. Once that disc is fixed, we don't just stop there. Then we go after the muscles, and that's step 2, and we use an advanced technology known as SpineForce, which was brought to the United States from France, and now it's available in San Diego. And that allows us to balance and strengthen the muscles. And then the third step is just to prevent the problem from coming back, because a lot of times somebody will get surgery or they'll go through treatment, and then 2 or 3 years later, of course, the problem comes back, and then they have to start the whole process over again.
Right, maybe they're moving and they're picking up a box, they don't bend their knees, and boom, they're right back to where they started.
Absolutely.
Tell me about the SpineForce treatment from France. How does that work?
Well, what happens is when somebody experiences a back injury, over time they're going to start to use certain muscles in their back less and less. So maybe muscles on one side of the spine will be stronger than the other. And what this technology is, this is an advanced machine where they'll actually stand on it, and it forces all of their back muscles to work as one unit, as opposed to just working each individual muscle separately. So it allows them to work as one unit and strengthening their entire back, and that allows them to keep the condition from coming back, which is really important.
So it's actually a machine.
Oh, yeah.
And do you tie a belt around someone? How does the contraption work?
Well, they're actually standing on it, they're holding on to it. It takes them through a bunch of different balance movements, and you can use this from the age of 18 to the age of 88, which is really, really phenomenal for somebody who has a back injury, somebody who even has balance problems. They can use this technology, and it's a simple procedure. They stand on it, and it rehabilitates their entire spine. And it's very, very effective.
Talking about the maintenance, okay, let's say that you go through the 3 steps that you were talking about. Maintaining a healthy back. Give us just some really good common sense reminders so we don't have to go through that vicious cycle again.
Well, one of the main things is to make sure that you're active after you go through the treatment program. One of the main things people worry about, they're worried about re-injuring their back, and realistically, you want to try to become more active after you've properly treated your back condition. So finding an exercise that you like doing, whether it's walking or hiking or martial arts or yoga, whatever it may be, that's one of the biggest things. And then, of course, looking at your posture, you want to make sure that when you're sitting, you sit upright. You want to make sure that you're not sitting for too long. You move around, making sure you take the proper supplementation, drinking lots of fluids. There's a long list of things that you can do to prevent your back condition from coming back, and just thinking about what caused your back condition in the first place. Was it a particular sport? What was it?
You know what, and I think it's so interesting. I mean, I know that I'm guilty on a computer a lot during the morning, and I find myself kind of hunched over. What's the proper posture, Dr. Pritzker, that we should be using so we decrease the chance of having back pain?
Well, right away you said you're hunched over. So
yeah.
The main thing you don't want to do is you don't want to hunch over. That's really the main thing. And it's almost impossible to keep reminding yourself to straighten your back out. So the simplest thing you can do is just get a pillow or roll up a towel, put it into your low back, and what it'll do, it'll straighten out your back. And that takes so much pressure off of the disc space. And just play around with different positions. See what's comfortable for you. Something that might be comfortable for you might not be comfortable for somebody else. So
I prefer a back massage all morning, but I could do that.
That's certainly, yeah, that might work.
Okay, now you have a free video that has so many wonderful tips on it, and I'd just like you to tell our viewers about it in case they don't know about this.
Yeah, well, we just touched upon some of the therapies that are available, but when you look at the video, we go over in detail more about the spinal decompression therapy, about the SpineForce therapy, all of those different things that you can do to prevent back pain and to get rid of your back pain. So that's what the video talks about.
And it's so easy.